Okay, today I want to talk about a supplement that's been touted to help joint pain and to strengthen connective tissue. This particular supplement is called Hydrolyzed Collagen. It's usually available in a powder or tablets. The powder is really the only one to use because you have to really use about at least 10 to 15 grams a day of this particular supplement to get any benefits at all. Now, what is collagen? Collagen is the most abundant protein in the human body, and it's the main structural component of connective tissue. This includes ligaments, tendons, skin, muscles, all depend on collagen for their structural integrity. In other words, the collagen is what basically holds connective tissue together. Obviously, if collagen starts to break down, you're going to have problems with connective tissue, and that translates into joint pain, uh, excessive aging of the skin, bone problems. Your bones are largely made of collagen also. Collagen exists naturally in food sources such as beef broth and gelatin. Gelatin is basically collagen, but hydrolyzed collagen supplements are 90% absorbable compared to the 27% absorption rate of food-based collagen. And that the one obvious reason for this is that hydrolyzed collagen, the word hydrolyzed, means that it's broken down into its component amino acids. So it's basically like taking an amino acid supplement. It's rapidly absorbed and absorbed more completely than whole collagen, as it exists in gelatin. On the other hand, there's one study that found that oral collagen supplements were broken down in the gut and had no activity. But this doesn't explain the many studies that do show that only oral hydrolyzed collagen is active in the body. In other words, in the one study that showed no effect, I don't think they use hydrolyzed collagen. They just use some collagen supplement, and that has very low bioavailability, so it obviously didn't work. As I said, the amino acids in hydrolyzed collagen are already broken down, so the digestive process would have very little effect on them. Now, there are 16 types of collagen, but 80 to 90% of the collagen in the human body consists of three types: collagen 1, collagen 2, and collagen 3. The primary purpose of collagen is to help tissues resist stretching. In other words, they give strength to connective tissue. When consumed orally, peak levels of collagen peak in 1 to 2 hours and then decline about 4 hours after oral ingestion. When your body produces collagen, your body produces collagen, but the production tends to decline with age, and this causes a lot of the aches and pains and joint pain and skin aging that you see as people get older, because your skin is basically composed of two proteins. One is called elastin, which, as the name implies, provides elasticity to the skin, and the other one is collagen. Collagen actually basically plumps the skin up. So if collagen breaks down, you have little, more or less, cracks in the protein structure of the skin, and that's wrinkles. So anything that can keep the collagen going in the skin is going to make your skin look younger, which also explains why dermatologists sometimes give collagen injections to people that want to erase fine lines and wrinkles on their face. The collagen injections are not permanent. However, they last maybe a couple of months, and then you have to keep going back to get them. Now, as I said, the hydrolyzed collagen supplements are available. The question is, what benefits do these supplements offer? Is it worth taking hydrolyzed collagen supplements? A 2006 review found that hydrolyzed collagen is useful for treating arthritis. Oral collagen supplements can also increase the retention of moisture in the skin and support the natural collagen structure of the skin. A 2014 study of 69 women provided with either a placebo or 2.5 to 5 grams a day of hydrolyzed collagen for 2 months showed improvements in skin moisture and skin elasticity. Other studies have shown similar results, and this is attributed to the collagen supplements boosting the natural production of collagen in the skin. Besides promoting natural collagen production, collagen supplements will also increase other skin proteins such as elastin. As I said, elastin and collagen are the two main proteins of the skin, and another primary protein called fibrillin. Hydrolyzed collagen supplements can also decrease joint pain. A 2008 study of 72 male and 72 female athletes for 24 weeks showed that those who ingested the collagen displayed the reduced joint pain while walking and at rest. The optimal dose of hydrolyzed collagen to treat joint pain is 10 to 12 grams. Now, one thing to remember, notice this study was 24 months, which is 2 years. The one thing I would tell you about hydrolyzed collagen, it's similar to other joint supplements such as glucosamine and chondroitin in the sense that it takes a while for these supplements to show benefit. One reason for that is connective tissue has a very poor blood supply, and it takes a while for these, let's say, these supplements to get incorporated into connective tissue. So it takes several months. If you're going to try a hydrolyzed collagen supplement, I would suggest giving it at least 4 to 6 months to notice any results. If you take it for 2 weeks, it's not going to do anything because it has to get incorporated into the joint. Studies show that ingesting a combination of collagen and calcium helps prevent bone loss. This is especially important to women who are more prone to a bone-wasting disease called osteoporosis. If you take calcium and collagen, it might help to prevent that, along with exercise, weight-bearing exercise in particular, and also attention to estrogen levels is also important for retaining bone mass in aging women. Women who ingested collagen supplements showed a 7% increase in bone mass. And as I said, it might help prevent osteoporosis. A study of 53 men, average age 72, who ingested either 15 grams of collagen or a placebo, showed that those in the collagen group gained more lean mass during a weight training program. Now, these men, older men, were suffering from a condition called sarcopenia, which is a loss of muscle mass with age. In other words, they were losing a lot of muscle. So the effect, when they took hydrolyzed collagen, they gained lean mass and they also lost fat. Now, this study has been criticized by a lot of researchers because the men actually put on an appreciable amount of muscle, and the researchers point out that hydrolyzed collagen is an incomplete protein. It's a poor quality protein, so the odds of it packing on lean mass are nil. That's what the other critics of this study say. However, if you look at the other effects of hydrolyzed collagen, such as an increase in joint integrity and stronger connective tissue, this can translate into higher training intensity. The higher training intensity, in turn, will actually put some muscle on even older men. In other words, if you could train without pain, you'll be able to train harder. It's that simple. Now, some of the research of this study of collagen in older men, they really weren't sure of the mechanism. They suggested that collagen's rich content of the amino acids glycine and arginine might have played a role in these anabolic muscle effects of collagen. Another possibility is increased microcirculation of blood in the muscle, which of course will deliver nutrients such as amino acids to the muscle more efficiently. You should know that collagen types 1 and 3 are specific to joint, tendon, and ligament support. So if you're taking a hydrolyzed collagen supplement, make sure that it contains collagens type 1 and 3. Type 2 is another type that's also good for connective tissue, but types 1 and 3 are the main ones for tendon and ligaments. A 2017 study showed that ingesting 16 grams a day of a collagen supplement for 6 months in 31 people decreased arterial stiffness, which can help prevent atherosclerosis and cardiovascular disease. Now, the stiffening of the arteries or the loss of arterial flexibility is one of the first steps of a progression to atherosclerosis, which is basically literally hardening of the arteries. Any way to keep your arteries elastic and flexible will help to prevent atherosclerosis and subsequent cardiovascular disease. One reason why younger women under the age of menopause rarely have heart attacks and strokes is because the higher estrogen they produce tends to promote nitric oxide synthesis. Nitric oxide itself helps to keep arteries supple and flexible, which is what protects women from cardiovascular disease. Estrogen also tends to raise high-density lipoprotein, cholesterol, which is also a protective factor against cardiovascular disease. I should, however, point out that the type of hydrolyzed collagen used in this cardiovascular preventive study was a special type that consisted of only 3 amino acids. It was a tripeptide. In other words, it's not the type that's sold on bodybuilding sites and as a supplement targeted at people involved in weight training. This was a special type of collagen supplement. However, it doesn't mean that taking the, let's say, the more conventional hydrolyzed collagen might produce similar effects because it has the same amino acids in it. Other suggested benefits of hydrolyzed collagen include healthier hair and nails and increased gut health. A little point of history here. The very first amino acid supplement produced way back in the 70s was actually made from hydrolyzed collagen. It was a liquid amino acid, and this was the very first amino acid supplement on the product on the market, I should say. It wasn't a very good supplement because one of the problems with collagen is it's a little bit low in the essential amino acid tryptophan, and as such, it's not a complete protein, so it's not really optimal for building muscle, which of course means that these original hydrolyzed collagen supplements weren't very good. Later on, the manufacturers of these supplements, it kind of dawned on them that these products they were touting as amino acid supplements weren't very efficacious, so they started adding tryptophan to the hydrolyzed collagen formula, which of course improved it greatly. And when they did that, the formula was actually just about as good as animal proteins like milk protein and eggs. The taste was still pretty bad though. Side effects from collagen are rare, but it may include some people get a bad taste in their mouth, and others get this feeling of fullness. But these side effects are very rare. Another thing, I have a theory about hydrolyzed collagen. A lot of bodybuilders and anybody really over the age of 40, you might notice like the skin on your upper arm, like right over here under your triceps, over here, triceps, and other parts of the body, starts to take on a kind of, I wouldn't call it a wrinkled appearance, but like a kind of a saggy appearance, where the skin looks a little bit saggy. And this has nothing to do with fat. I believe that, when I think about it, I think it's a loss of skin elasticity. And I think it's caused by a gradual breakdown of elastin and collagen in the skin. Now, again, I have nothing to prove what I'm about to say, but I'm suggesting that if you're over 40 and you want to possibly prevent this kind of saggy skin effect, and I've seen it on Arnold, I've seen it on a lot of older bodybuilders. It has nothing to do with being bad health. It's just a breakdown of the supportive connective tissue proteins in skin as you age. I think there's a possibility that if you use a hydrolyzed collagen supplement, you can minimize that. If you start it early enough, you could minimize that saggy look in the skin. I have nothing to back this up. It's just a theory of mine based on the fact that I think that the saggy skin is caused by the fact that the body does not produce these proteins at the same rate when you're older as they do when you're younger. In other words, your body doesn't produce enough elastin and collagen to elicit full skin support, so the skin gets a little saggy. So I think that possibly taking hydrolyzed collagen, you'd have to take this for a long time, obviously. You'd have to take it regularly to prevent this. I think it might help, and antioxidants might help, because oxidation also causes a breakdown of the skin proteins. So you want to take antioxidant supplements like vitamin C, E, and that type of thing. So you might consider that. Again, this is not from any study, it's just from my own theory, but I've seen it. Just about every bodybuilder over 50 has a little bit of this sagginess. Usually, again, you can see it in the upper arm especially. And that's a breakdown of connective tissue protein in the skin. So I hope you got some value out of this video. If you want further information on nutrition, exercise science, food supplements, anti-aging research, fat loss techniques that really work, ergogenic aids, Subscribe today to my Applied Metabolics newsletter. 40 to 50 pages every month. I work very hard to bring really useful and practical information every month. And it's more like an ebook than I don't know why I should have called it a newsletter. It's more like an ebook. Like I say, 40 to 50 pages. And I guarantee you will learn something no matter what your level of education. Subscribe today. I cover the waterfront, and it's not the same stuff you're going to find on the web, the usual garbage on websites and so-called science blogs. My stuff is much more in depth and also covers topics and information that you won't find on the web. So subscribe today, www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. The best. I was going to bring Bruno into this video, but he's hiding somewhere. So maybe I'll get him in the next video. Anyway, take care. Have a good day or evening or wherever it is where you are. Take care.